For about 40 years, Saudi Arabia has been sending prospective doctors to Canada for their medical training, and the kingdom pays handsomely to do so. But now it is telling all its current Saudi students here to pack up and leave. And that means roughly 1,000 medical residents and fellows are suddenly being ripped from the Canadian healthcare system. Katie Nicholson sizes up the impact.
Patients line the hallways of Hamilton General, clearly a hospital already under pressure. Conditions may soon worsen.
Ultimately, it will put a significant strain on a system that is already significantly strained.
Hamilton Health Sciences is poised to lose 15% of medical residents. The doctors in training can be the first specialists patients encounter. All casualties of Saudi Arabia's campaign against Canada, all ordered out of the country and out of this hospital.
It's a kind of a black swan event for us. We certainly didn't anticipate this happening at the start of this year, so this is not in our budget.
Right now, Saudi Arabia covers much of the cost for its doctors who train in Canada. Now, hospitals will have to find money to bring in physician's assistants and nurse practitioners to deal with this urgent problem.
It's an unexpected blow throughout the country. There's no question.
Kerry Bowman has taught Saudi medical students in Toronto for years.
We benefit, and so does Saudi Arabia. So to a large extent, it has worked very, very well. So they're picking up greatly needed skills and bringing those skills back to the Middle East with them. We are receiving very high caliber doctors who are working frontline with our patients at no cost to Canada.
But now, Canada will have to pay a price, beginning with the doctors left behind.
We'll have to pull more on-call duties on nights and weekends. They'll have to look after more patients in the floor. They'll have to have more help in the operating room to cover the volumes.
Not that the Saudi doctors have it any easier. Their lives pulled out from under them.
What we're already seeing is a certain degree of panic as these young people are trying to organize their lives and their families. Some of them have only just arrived in Canada, just signed a lease for an apartment. Maybe they bought a car and got their kids organized in school.
So where will Canadian patients feel it when they walk into a hospital? In the short term, doctors say there may be longer wait lists for emergency care or to see a specialist, but they say the system will recover. Katie Nicholson, CBC News, Toronto.
It's been 4 days now since Saudi Arabia started this diplomatic war against Canada for criticizing the country's human rights record over Twitter. While Arab states have rushed to defend the Middle Eastern kingdom, Canada is standing alone. Katie Simpson explains why our closest allies are largely staying mum.
When Canada hosted the G7 summit, the Prime Minister stood alongside his closest international partners. But as Canada wades through a messy diplomatic dispute with Saudi Arabia, he's getting little public support from those same trusted allies.
We have seen a weakening of the sort of solidarity that I think would have been taken for granted a few years ago. And that is a very, very worrying thing.
This former British High Commissioner to Canada is disappointed the UK and the US are staying neutral in the spat. The British Foreign Office offered a brief statement saying Canada and Saudi Arabia are both close partners of the UK and we urge restraint. And earlier this week, the line from the US, Canada is on its own.
Both sides need to diplomatically resolve this together. We can't do it for them. They need to resolve it together.